Hello, Victoria. It's nice to see you in the office today.
Oh, I was really hoping I wasn't going to be here today, but here we are.
That's okay. I think, Christine has come in and she's done all of the usual things that we do in our visits. But I've come in now because I wanted to talk to you about, what our options are at this point now that you've gone, a little bit further along. Have you had any signs of labor?
I've been crampy like in the evenings, usually for about the past 3 evenings, I've been kind of crampy, and then it just kind of doesn't really change. Like it stays the same and then kind of peters off and goes away. So I'm kind of hoping that one of these nights it keeps on going.
Right. Yeah. So you're kind of looking to have your baby then.
Yeah. I think are we a week over tomorrow?
Mm-hmm.
Yeah.
Yeah.
So I think that this baby's pretty cozy in here, but yeah, it would be nice to not have to go too far.
Yeah.
Too much longer.
Well, we have a few options, and I'd like to talk to you about one specifically that might be something that you would consider at this point in your pregnancy. It's called a stretch and sweep. Have you had a stretch and sweep before?
I have with my first baby and my second baby. Both the babies, the doctors just did them. I guess they didn't really tell me much about them.
Okay.
Right?
Would you be interested to hear more about it?
Yeah, I would.
Yeah. So essentially, a stretch and sweep is a non-pharmacologic way of helping to get your labor started.
Okay.
And it seems to be most beneficial actually in people who've had babies before.
Okay.
Some, but not always, have sometimes gone into labor soon after having a stretch and sweep. Okay. So sometimes people think of it as sort of a tool that might help to get the process going a little bit sooner than they think. And in fact, when they look at the research, they actually can see that people who have stretch and sweeps and are into labor usually a couple of days before what their typical due date might have been.
Okay.
So it does have that sort of going for it for sure.
Okay.
So a stretch and sweep has a few risks, though, that we should probably talk about. So one of the main risks of a stretch and sweep is the discomfort that you would feel from getting a stretch and sweep. So
it's like a vaginal exam, right?
Yeah. So you might recall that the stretch and sweep itself is a vaginal exam, and then it's actually manipulating your cervix. So what I would do is I would insert 2 fingers into your vagina. I would flip my fingers over. I would find your cervix. And if it's open at all, I would stick my fingers in your cervix and I would stretch it open.
That sounds so pleasant.
Well, it isn't. And that's the discomfort. And that's one of the main risks of having the stretch and sweep, is that it can make people feel really crampy. Yeah. And the cervix actually has a lot of nerve innervation. So some people might even describe it during the moment as being a bit of a sharper pain.
Right.
And because there's a lot of blood vessels in the area, there's often a little bit of bleeding that comes afterwards. And some people will find that to be a little bit concerning when they're pregnant, to have bleeding like that.
Right.
We wouldn't anticipate it to be more than a teaspoonful.
Okay.
But you might see a little bit of spotting.
Yeah, that's okay.
So once the fingers are in and the cervix is stretched, what I would also do is I would try to get my fingers in far enough to actually separate the amniotic sac from the side of the uterus. Oh. And that's the sweeping part. Okay. And what that does is it releases prostaglandins, which actually helps your cervix to get more soft and more ready to dilate for when your contractions begin.
Yeah. Okay.
So there's a little bit of benefit there. That also feels uncomfortable, and people will say that it feels like really heavy cramping when that happens.
Like heavy, like deep in your pelvis,
deep in your pelvis kind of thing. So what I try to do when I'm doing the procedure is to take some breaks. Because the more that we do it, the more beneficial, the longer that we do it, the more beneficial it is. And sometimes it takes some time to find your cervix and to get my fingers into the places to do the work. Okay. But I often will just sort of take a break so that you can catch your breath and not have the cramping the entire time.
Okay. Okay.
Another risk of doing the stretch and sweep, as you can imagine, because my fingers are inside the bottom of your uterus, and I'm touching the membranes around the babies.
Yeah.
around the baby, pardon me, there is a risk that I could break your water.
Okay.
And I can say that I've never done that before, but I have seen it happen. But those waters were going to break anyways, likely because there would be a lot of pressure in order to do that. I'm not introducing anything to break the water, but if I were to break your water, then we're sort of committed to having the baby within the next 24 hours.
I'm committed to having the baby in the next 24 hours.
If your labor didn't start spontaneously, well, if your waters are broken, then you might be looking at a similar thing to your first pregnancy where you had that induction.
Okay.
Yeah.
All
So
right.
that would be a risk. Now, the benefits is that, yeah, you could potentially go into labor. The number of people who need to have a stretch and sweep for it to be successful is actually 10, which is actually a really good thing in medicine because there's not a lot of things that you can do and have such a benefit to people. Some people like to have more than one stretch and sweep for that reason. Other people like just to have the one, and sometimes it's enough for what you're needing to do.
Okay.
Now, there's no absolute reason that you need to have a stretch and sweep done. It sounds like you're going into labor anyways. If you chose not to, you would likely go into labor on your own, or we might choose to revisit this option again in a few days if you were still pregnant.
Okay.
There is, generally speaking, as you mentioned, like some offices will begin doing stretch and sweeps, even without, unfortunately, telling people around 37 weeks of gestation and do them weekly until delivery. I would say that in our community, we tend to start offering them to people at 38 weeks. And then if people would like to have them at that point, they do. And if they don't, then they will do them later as they get closer to their due date. If for some reason your water were to break and we needed to start oxytocin, I'm able to do that. So there would be no consult or transfer of care for the remainder of your labor and delivery. But if something more complicated happened, and a very unusual circumstance that your water broke and there was a cord that came with that, that would be a transfer of care because that would be an obstetrical emergency.
That doesn't sound like it's very good.
No, no, it wouldn't be. And then just so you're aware for my biases, I tend to use stretch and sweeps only on request. I'm not against them. I'm also not for them, but I do know that people are probably going to go into labor on their own. As I get closer to people's time that they're getting towards 41 weeks, I do tend to start to feel like this is a really great tool to use. So my bias is towards using stretch and sweeps in this time frame. So we're having this discussion because part of that is in my bias to offer it to you instead of having offered it to you earlier.
Okay. I know, I appreciate that. Nobody ever really told me in my first 2 pregnancies what they were doing or what it was for. So I really appreciate that. And do you think there's anything else that we can do other than a stretch and sweep, or like just a stretch and sweep at this point?
Yeah, so we do have other options as well. And they involve some more pharmaceutical kind of agents. So we can also get your cervix ready with some medications. One of the medications is inserted into your vagina. Another one you can take orally. Those ones there would be a transfer of care at this point in your pregnancy because we would be trying to manipulate your labor with a pharmaceutical agent before you're past 41 and 3. Once you get 10 days past your due date, I could do that without doing a consult or transfer of care.
Okay. So I think, were you all done telling me everything?
Well, I was going to say the other option is a mechanical method like a Foley catheter, which will open your cervix, but it doesn't actually help with getting the contractions started. I think just when providing the sort of history that you're given with that you're already experiencing some contractions, you're really close to your due date, and if we want to avoid just having a transfer of care, I would recommend that you go with a stretch and sweep.
Yeah, that's what I was going toward. I kind of want to avoid the other induction methods if we can, but so I think that this seems like the least invasive thing to do at this point to try to get things going. Yeah. Great. So I think let's do it, Joyce.
Okay. I'll step out of the room so that you can get undressed.
Fabulous.
Okay.
Thank you.